A very good morning and thank you for joining us. Welcome to our special commemoration of the Day of the African Child, which was, I think, about 2 days ago. And this morning we'll be speaking to children, and if you could put those children on the screen, they are special guests for our panel. And I also have a panel with me that will be taking the questions that the children will be posing to them. I'd like children to quickly introduce themselves with just their name and also where they are coming from. Right, as we wait for the children to be put on the screen, I'll introduce the panel that is before me, and I'll start at the very end. Dr. Jessica Nsugwa, the Commissioner for Maternal and Child Health at the Ministry of Health. Thank you for joining us, Dr. Jessica.
Good morning, viewers, and good morning, children.
All right, and next to Dr. Jessica is Afande Fred Enanga, the Commissioner and spokesperson of the Uganda Police Force. Thank you so much for joining us, Afande.
Yeah, it's a pleasure to join you too. Good morning, everyone who is viewing us, our children. Regards to you all.
All right. And finally, next to me, we have Mr. Ismail Indra, Director, Basic Education, and the Chairman of the Education COVID Task Force, Ministry of Education and Sports. Thank you for joining us. Okay. Oh, sorry. Oh, I hope he can hear me. I don't know if he was already allowed into the room. Mr. Molina, can you hear me? All right, when Mr. Molina joins the conversation, we will be able to show him on the screen. But next to me, Mr. Mondo Chateka, it's a pleasure to have you. You're constantly here speaking about children's issues, and you really never go wrong. Mr. Chateka is the Assistant Commissioner, Youth Affairs at the Ministry of Gender, Labour and Social Development.
Good morning, Josephine. Good morning, the children, and good morning, everybody who loves children and who works for the protection of the rights of the children. Good morning.
All right. Well, thank you very much to our panel. The children are ready. I can already see some of them on the screen. And I'd like us to start with them introducing themselves. Good morning. Can you hear me?
Good morning.
All right. Can we start by introducing ourselves? Each of you, just one by one, tell us your name and tell us where you are from. Just the district that you're from. Okay. Gift Ankunda. Gift, are you there?
Yes, I'm there.
Gift Ankunda, are you there? Okay, so I think what we're going to do while the children set up is we're going to just really get into our conversation with the panelists here as they finish their setup. And I just really want to get a sense from each and every one of you how COVID-19 has affected your particular sector in regards to children. I'll start with you, Dr. Jessica.
Thank you very much. I'm glad to be here. We all know that COVID has taken its toll, mostly on adults. And the numbers we report, around 700 cases now, are mostly adults. But we also know that there's an invisible chapter to this whole phase. The invisible chapter and the invisible people are the children, are the people who behind there, the mothers, people who are more vulnerable, those with comorbidity. And we are very much interested in looking at that segment. We have had very few children getting COVID, about 12 of them, and that's not a different picture elsewhere in the world. Children are less prone to severe illness, but we also know that they also get infected, and they're the commonest carrier of infection to the elderly, to the adults, especially the young ones and the adolescents. So yes, they get infected, but they don't get very many symptoms. However, when the consequences of COVID come on, given this long haul of this pandemic, be it economic, be it nutrition, be it care, psychosocial problems, most of the toll is centered on children. And that's why I would like to change the discussion and what is going on in the public to make sure that we don't lose this invisible side of COVID. Our children who are very vulnerable, when parents are sick, or when they need to be quarantined, or when they are worried, the children are usually in the background. When we are talking about COVID in most of the audience, we're talking to adults. And we forget that the children need to listen and know about COVID in their own way. Very few families are sitting down to discuss with children about COVID. And even when they do, they don't talk to them in an age-appropriate way. They don't consider their level of development, their anxiety. People think that children don't understand, they don't worry, they live in the present tense. But many children are doing so much guesswork, they are synthesizing, they are looking at the media. So we would like to change the chapter and segment this population and make sure that we center it, because the long-term consequences of COVID will affect this future generation. And that's why I'm glad to be here to talk about this issue.
Thank you very much, Dr. Jessica. I want to just check in if Mr. Ismail Indra has been able to join us on the call. Mr. Indra? Okay.
I've joined you. I've already joined you.
All right. It's great to have you this morning. Mr. Melinda is the Director of Basic Education and the Chairman Education COVID Task Force with the Ministry of Education and Sports. Thank you for joining us. I want to check in with the children before I engage the rest of the panelists, and just to check in, sort of to do roll call. I'm sure it's been a while since they did roll call since school's closed. Gift Ankunda, are you there?
Yes, I'm there.
All right, Gift Ankunda is from Kampala. She's from within this area, and I know that she had a question for you. Gift, do you want to ask your question?
Yes. My name is Gift, and I'm from Namugongo.
Gift, do you want to wave at us so we can see it's you?
My question is going to the Ministry of Health.
Okay.
And on what is the strategy to eliminate COVID-19 in Uganda, because it has affected many people.
Gift, do you want to give us that question again?
Yeah, my question goes to the Ministry of Health. What's the current strategy to eliminate COVID-19 in Uganda, because it has greatly affected very many people.
Okay. Gift's question, what is the current strategy to eliminate COVID-19? It has affected a lot of people, and I think what most of the children are hearing at home is wash your hands, wash your hands. Are parents equipped to explain all of these things to them as they should? Dr. Jessica, that question was for you.
Thank you very much, Gift. I think to be able to understand how to eliminate COVID, we need to understand what COVID is. And I would like to spend 1 second describing what COVID is. COVID is a virus. It's an infection which is transmitted through droplets from somebody's mouth. Small pieces of saliva which carry the organism, and when they fall on somebody, especially the soft parts of the body, the mouth, the eyes, the nose, then they enter your friend or your neighbor. And that's why we're encouraging holding masks. But also because these droplets can fall on books, can fall on surfaces, you can also get COVID from the surface. The best treatment, when this COVID gets into the body, it most commonly affects the parts of the lung, but also the blood system. And most of the organs, when they suffer this stress of the organism, they are also compromised and they stop functioning. A virus, as compared to what we call bacteria, I think you studied something bacteria, is not treated with an antibiotic. The most important thing is to weaken that virus, and the best treatment is to give a vaccine. And the vaccine can be given before you get the infection, so that when you are attacked with a vaccine, it's weakened because it finds some soldiers in your blood, what we call from the vaccine, so that it's ready to weaken the virus. We have other diseases also which are caused by viruses. We have very many flus which have been weakened because we have vaccines for them. We have measles, we have HIV, all those are viruses. And the best treatment for this pandemic we have will be a vaccine. However, we can, in the meantime, because the vaccine is being developed, a lot of work is going on in the labs to come up with a safe and an effective vaccine. We can actually mitigate or address the complication the virus causes. When you get a virus, because it affects your organs, we can support your organs in that critical period when you have a lot of infection and help you to survive. We can give you machines to support your breathing. We can give you fluids to support your body so that the blood circulates very well. We can give you drugs to put your temperature down. Some people get diarrhea. We can support your organs to go through this challenge. And your natural immunity, your natural body protection takes over so that you survive. So the main solution is going to be a vaccine. But what we hear from the work, it requires to have a vaccine which is safe. Because vaccines are made from organisms which are weakened a bit and put in your body so that they can stimulate immunity without infecting you. It takes time to get a good vaccine which can be used and is safe. So it's going to take us like another 1 year. We don't expect a vaccine this year. And the best solution now is to prevent, protect yourself from getting this information. Stay away from a person who might infect you. Stay at home. We have closed the schools to move away from possibilities of getting contacts with infected people. You can use a mask when you go to the public so that you protect yourself. Wash your hands all the time. Like I have said, many surfaces will have organisms. Make sure that you avoid going into gatherings, going into functions, going to the shops where there are many people, going to weddings where there are many people. And the president has put this very good advice to us, and would like to make sure that we all follow. So that means actually, as we wait for the vaccine, the ultimate solution, we can actually keep ourselves safe. And you can see in Uganda, we have not lost any person. And we think that this has happened because we started very early. We put these things in place. We closed the schools. We put down the transport. We closed the churches to make sure that we don't have very many contacts. And now we have masks. Masks are now being distributed in the districts, and also for children who are above 6 years. Each one of you will get a mask, and we want you to wear it properly. Wear it when you go to meet people in the public. Make sure that you are fighting for your health as we wait for the vaccine to come.
Right. Dr. Jessica, since we're speaking about health, and I know the other children have questions as well, but a child has sent me a message and they're asking, why are those masks being given to children above the age of 6 when even them at age 5, age 4, they're asked to go out to the shops, they're being sent on errands, or they go out of their houses?
Yes. Thank you very much. When we use these masks and we put them on our nose, we may not be able to breathe very well from your mouth. Children who are younger, especially 2 years and below, typically they breathe from the mouth. They are called mouth breathers because their organs are still growing. They're not very straightened, and some of the people have allergies and they have swellings. So children are usually mouth breathers. So if we put a mask, a surface on your mouth, children below 2 years may have a difficulty in breathing, and we could have some problems. Not all of them will get problems, but some might get problems. Also, children below 2 years are very playful. It's very difficult to keep the mask on very well. They will pull it off and they will start biting it. And as I told you, you can get even infection on other surfaces. So for children, using a mask below 2 years may not be very helpful. Similarly, because they can't care for it. Similarly, the children below 6 years also, evidence has shown that they may have problems using these masks, and they need a lot of supervision. The best thing is not to send these children outside the home, because as I said earlier on, they also pick infection. They may pick infection and not get to be hospitalized because they don't normally get very sick, but they'll pick this information, bring it home to their mothers, to their grandparents who have other diseases, who are very likely to get infection. So parents outside there, limit movement of these children. Keep them at home, keep them indoors, and keep them away from people who can infect them.
All right. Thank you very much. Dr. Jessica has been speaking, and people might think we only have a medical expert in the house. I'd just like to point out that we also have other people, and this particular show is brought to you by Save the Children Child Fund International, TDS, Plan International, SOS Children's Village International, and World Vision. Dr. Enanga, what has been, Mr. Fred Enanga, forgive me, I've given you a new title. What has been the impact for you from the police force in terms of cases? Every time we're told to stay home, we know that a lot of things are happening, in the homes that are putting children at risk. What has been the impact that the force has seen of COVID-19 and the lockdown on children?
Yeah, thank you very much, Karenji. And to the children who are out there, how are you? On the side of law enforcement, we are working as a joint security task team that is actively involved in enforcing the measures that were laid out by the Minister of Health, together with the guidance from His Excellency the President. And I think this is how most of the pandemics have been policed. I think if you go back into history, you find that law enforcement actually comes up to support the frontline agencies like the Minister of Health and so on. And it's something that we've done before and we are continuing to do. Now, you're very much aware that the policing of the COVID-19 is somehow unprecedented because you're dealing with something that is invisible on the other side, and it's also very unpredictable. It comes with its challenges. But as the joint security agencies, we came up with contingency plans on how we can get to enforce the measures in place. And beginning from 19th March, you could see that as we progressed with the different phases and with a number of restrictions, the bans on public gathering, movements, and even with the inception of the curfew, we came up with the accompanying measures to enforce these the measures that were in place.
But
now, what going back to your question, as the joint security agencies, we need to come up and tell the public that as far as crime is concerned, we have seen a very huge reduction in especially the traditional crimes. The crimes that used to be so prominent were basically crimes that were alcohol related, and with the closure of bars and all these entertainment places, we've seen a very, very big reduction in most of the crimes that used to happen from 7 p.m. up to 6 in the morning.
And by this, we're looking at crimes like robbery and
yeah, we are looking at
like
crimes like robbery, crimes like rape, crimes like defilement, which happen in deep night. And in addition to that, the restriction on movement of vehicles, as well as borders, has also helped us a great deal in that it has not facilitated criminals into committing crimes. Because during those ordinary hours, wherever we had movement of borders and private vehicles, it could enable the criminals to get away from scenes of crime.
Right.
So you find that with this restriction on movement of vehicles and borders at night, there has been a very, very big reduction. It has actually challenged criminals a great deal that it is very difficult for them to get away from a particular scene of crime.
All right.
And this has helped us a great deal.
Mr. Nanga, when you say the crime rate has gone down, it's contrary to what we've had a few weeks ago. I had a show and we're talking about the crime in Liantonde, and I was asking in specific regard to children because they have about over 100 cases of child-related cases that have been reported, among them rape, incest and so on. And I'll just ask Commissioner Chateka to speak in that regard, on what's happening in families.
Let me just, Josephine, if you could allow, first give some small background. The Day of the African Child that we are here to scientifically celebrate dates back in what happened in Soweto in Johannesburg, when thousands of children who marched to protest against the bad education they were receiving were massacred. Hundreds of them were massacred. That was precisely on the 16th of June, 1976. In 1991, the then Organization of African Unity, now African Union, designated 16th of June every year as a day on which we take stock of the things we are doing to protect the children and ensuring that the children are enjoying their rights consistent with Article 34 of the Constitution of the Republic of Uganda. So somebody out there may be asking, why do we mark and celebrate this day? We mark it to take stock of what we are doing, but also to remember those children who were senselessly massacred by the then the apartheid regime in South Africa. Now, going to what you have just asked, I actually carried the paper, the monitor, which is talking about the case you are talking about. Defilement cases increase in the Antonde during lockdown, but also on page 11, defilement cases on the rise in Busia district. This where a 165-old man defiled a young girl of 12 years and gave 500 shillings, and somehow the case got to be known, and it was because the child had been sent to the shop at 6:30, and that's what Dr. Nsungwa is talking about, that let's not send these children out during awkward hours, because we are tempting the devil. So it's true, it's also true what Mr. Nanga is talking about, that crime related to, you know, burglary, this and this, but you know, children are confined within the community at home, and as you know, most of the rapists, the defilers, are people close. They're within the people they know, according to the VACA report that the Ministry of Gender carried out. So there's certain crime that has gone up. Yesterday on NTV, I was watching a Jambo, Jennifer from Ruero, 30 years. Dr. Jessica may get interested. 30 years, she has 6 children. She was hacked by the husband because of asking for things that the husband doesn't have. I was also reading this morning, the deputy to Mr. Fred Enanga, Namaye, was reporting of a case in Kabale where a man committed suicide because the wife had asked for salt, and was asking for how much is salt. So issues of suicide, issues of femicide, issues of incest, rape and defilement, transactional sex, issues of malnutrition, issues of family abandonment, and I was sharing with Dr. Jessica and Commissioner Fred Enanga before and said, why are men cowards? Most of the people who are abandoning their families are the men. They abandon the family, and so children and the wife have no access to the basic necessities that they need in their homes. So there are issues of domestic violence every day. There are issues of teenage pregnancy. Teenage pregnancy is on the increase. We have been standing at 24.5% teenage pregnancy. I'm sure by the end, I know it will end. Things come and go. Somehow. By the end of coronavirus, it's likely that teenage pregnancy is likely to be higher because children are idle. People are idle. People have access to them. But there's also the abusers. There are also cases where people are selling off children. That's early marriages.
Commissioner, you have quite a number of the cases, and I want us to break them down in different bits. But I want to bring in some of the children who had specific questions, and you know, especially for your sector and for Mr. Enanga's sector. I'm going to ask Nema Kembabazi from Wakiso. Nema, are you there? Nema, can you hear me? Okay, it seems Nema is off. Jonathan Mwanguzi, are you there?
Yes.
Jonathan, you can hear me? Jonathan is from Kampala. You had a question, and I think it was for both Commissioner Chateka and for Mr. Fred Enanga. Could you ask the question?
My name is Monks Jonathan. I am 13 years old from Kampala. My question goes to the Ministry of Gender. Some children are given drugs to sell, like marijuana, mairungi, and they end up using them. How are you going to help those children? Thank you.
That's a very good question, Jonathan. Jonathan is asking, some children have been given drugs to use and to sell, like marijuana and mairungi, and he's saying some of them end up using them. How are you going to help them?
Thank you very much, 13-year-old from Kampala. First and foremost, consumption of marijuana, consumption of drugs in this country is outlawed. It's not lawful for anybody to consume marijuana. So anybody who is doing it is doing it outside the law, and Afande Enanga has to deal with such cases. But we continue sensitizing people. First of all, if that is a child, also the child being involved in business, that is child labor, children have to be kept at home. And that's where we started, that during this period, it's very tempting to have a child out there. There are so many people who don't have anything to do, and they are waiting for anything to do, and anything to do with children. Children are soft targets. And so leaving your child to go, first of all, consume marijuana, which is unlawful. 2, selling marijuana, which is also unlawful. So such cases should be reported. May I request that our 116 is one of the essential services that was never interrupted. Can we report such cases on 116, and we shall work with police to bring the culprits to book?
Afande Enanga, do you want to respond as well?
Yeah,
Because he says, how are we going to help?
Yeah, we really need to help our little children. Remember that they're always taken advantage of. And usually our interest in our investigations, we tend to look at who is this person who is behind these children, who sends them out on the streets with drugs for sale, marijuana, and those who like using fuel for siphoning and so on and so forth. So we've been working very closely with the Ministry of Gender and the other stakeholders' cases here to get to ensure that we remove these children in a holistic way from the streets, and then talk sense into them, telling them the dangers that are involved in dealing in drugs. They start by selling the drugs, and then as time goes on, they start consuming it, and it becomes a problem for them. So we've been actively involved in carrying out these operations to get these children off the streets and get those who are behind them, especially from around Chisenyi and most of these suburbs that surround the Kampala metropolitan. But what has been helpful in this fight has been talking to them, counseling them. We do have a number of homes, rehabilitation homes that we work with, and a number of NGOs have partnered with us to ensure that we take these children. Rehabilitating a child who is into drugs actually takes a process, and it's even very expensive. Some of them can't afford. Government has also not come out strongly, but the NGOs have been assisting in these rehabilitation homes. Okay. But then we also noticed that there are some of them who are already affected by the drugs mentally, and we've dealt with Butabika. We've been taking them to Butabika for treatment and rehabilitation. And then in worst case scenarios, there are those children who have been heavily impacted on by drugs. In consuming it, they start adopting very aggressive and violent behaviors, attacking fellow children. You get disturbances within homes and so on and so forth. So those ones, we've been taking them on and working together with other players in the criminal justice system and getting them into the remand homes, where they also get taken through
Support.
the rehabilitation process.
All right, thank you very
Currently,
much.
if you could allow, may I add that over the period, the 3 months, we have removed 1,500 children from the streets, rehabilitated them, and resettled them. And we continue doing the same to ensure that no children is left on the streets, because we don't believe. There are human rights activists who say that, children should stay anywhere. We say no. Children are meant for their homes. Children are not supposed to be raised up on the streets. And we shall continue doing this to ensure that no child is left on the streets. So that services find children in homes, not
on the street.
streets.
You said 1,500.
500. Yeah.
Do we have a number on how many children are usually on the street?
We are carrying up a comprehensive survey, and it was interrupted by the COVID, but we should be able to have a more, crisp data on how many children, but they're in the range of 10,000.
Wow. Alvin Subuga. Alvin Subuga, are you there? I think that's Alvin
Yes,
trying
I'm
to speak to
there.
us. Alvin, how are you?
I'm fine.
Great. I know you have a question for my panelists. Where are you from and what is your question, and to who are you asking that question?
My name is Sumuga Andrew. I am 13 years old. I am from Entebbe. My first question goes to the minister, Mr. Molina of Ministry of Education. If COVID worsens, shall we just keep at home or the solution is being solved so as we can go back to school?
That's a tough one.
All right. Mr. Mlindwa, did you hear the question?
Thank you. I've heard the question.
Yes.
I've heard the question, yes.
So Alvin is saying, if COVID worsens,
Hello?
are they going to stay home? I mean, the number of cases are increasing. When are they going to be able to go back to school? And what are you doing to make sure that when the children eventually go back to school, they're safe?
Thank you, presenter. I want to apologize first because I went off and I have joined to win some very, very issues have been raised. I'm sorry, it is technology which has done it, but I just wanted to share this and say as a ministry, we are concerned with our learners who are not in school. So to go straight to the question, to sort of say, what happens if this COVID persists? Now, you have heard of a phrase where they say the new normal. The assurance I want first of all give that at one point in time, the schools will have to open. That definitely will have to happen. So I don't see a situation where our learners are going to keep out of school, even if the COVID pandemic worsens. What we need to do is to learn how to live with it. That's basically the issue. And as we talk now, we see how we can have the schools reopen so that our learners can go back
All right.
to their normal education kind of.
Mr. Mlindo, we can't see you clearly, but also we're losing a bit of your sound. So let's try to get a clearer connection for you, and then we can take that question again. But I will ask, let me ask Precious. Precious at Kunda, are you there? Precious, could you just introduce yourself and tell us how old you are, or where you're speaking to us from, and ask your question?
Question goes to police. How are you going to protect those girls whose parents have started selling alcohol from their homes, and the drunkard men have come with, and the drunkard men can come with bad motives?
All right, thank you, Precious. Precious's question goes to you, Afande Nanga, and she says, how are you going to protect girls whose parents have started selling alcohol from their homes and drunk men come with bad motives?
Yeah, thank you very much. What we really need to know is that right now there's still a ban on bars and drinking places. Therefore, if at all there is a family out there that is selling alcohol in a commercial way and attracting visitors or clients, revelers into the homes, that is already risky behavior that we need to counter as far as possible. What is important is that you as the young children, it's important for you to always monitor the current affairs that are taking place in the country. You have to be knowledgeable, and you also need to know which are the helplines that you can get to use to bring out such information. Children who are always vigilant within the homes do save a number of their family members from the dangers that could have happened to them. Because most of the crimes that happen in the home are usually opportunistic crimes that arise out of criminals taking advantage of the children. So once there's vigilance, then we are able to respond to some of the concerns raised by children during this period. But what we want you to know is that bars were banned. Activities in bars are still prohibited up to this time because there are no safeguards, there are no protocols that have been brought forward by the Minister of Health, and they're still working on that. So if there is a family that is out there that is selling alcohol, that is already a risky behavior, and it also puts our young girls in a more vulnerable position.
Are we asking the children to whistleblow their parents and report them and call 116? But are we also thinking about what that means for them when they report and maybe the parents find out? What kind of protection do they then have?
No. Our children should get to know that we do have structures. There are children committees up to the local council levels. They can get to either the Secretary Women Affairs, the Secretary Children Affairs, and they can, in confidence, pass over this information to them. But we've also given them our emergency lines that you can actually get through, feel free of charge, the 999 and 112. But there's also a WhatsApp number. This could be a bit expensive for them, especially the fact that they can't go online. Some of them have restrictions on use of phones. But the WhatsApp number for the police, where you can take pictures and send videos and images, is 0779. Then the rest of the figures are 99999. If you get 0779, then 9996 times. There you can send a video, you can send an image that comes to the Uganda police, and then we can respond to such complaints.
But we're assuming these children have access to all of these facilities, or that there is a phone that they can use. Commissioner Chateka, do you want to briefly speak to that before we take the next question? And the next question, I'll ask Mary Nakoru, but before you ask Mary, Commissioner.
Yeah, Josephine, it is true that not all children have access to phones. That's why because like Afande Nanga said, this is a very good one because they can WhatsApp, they can do this, and many children are upbeat with technology, but accessibility is the issue and also the costs. That's why we have alternatives. Like I mentioned, we have the 116 child-free toll helpline. Yesterday, but one, I was with a colleague from DPP's office. They have another toll-free helpline. The number is long, but it's 0800112300. Again, this is toll-free. And I also know that at Ministry of Health, there's another toll-free helpline, and Dr. Jessica Nsungwa will speak to that.
Yep, Dr. Jessica, could you just read the number if you have it?
I don't have it offhand.
Okay, yes.
That's 9 something. But there's a toll-free helpline at Ministry of Health that they have been talking about. So the issue of accessibility, the child can use the phone of a neighbor if he says, I'm not going to take any of your money. 116. And now let me speak to the neighbors, the children. We are saying, let's go back to the old African adage that it takes a village to bring up a child. If the child of a neighbor is in trouble and the child wants just to use your gadget, is not even going to take your airtime, please allow. Let's hope report cases. Cases are concealed because they are never reported. If they are not reported to Afande Nanga police, if they are not reported to LCs, then they die off. And society rots. One general in America said, society begins to rot the moment we keep quiet about things that matter. So let's not keep quiet about things that matter. Let's report them.
Well, before we even put the burden on the children, why isn't the neighbor reporting? Before they ask, the child has to go and borrow a phone from them.
That's the African adage.
Mary Nakoru, are you there?
Yes.
All right, Mary, do you want to ask your question?
My name is Nakoru Mary Indra. I study in Naitakwe. I'm 14 years old. My question is, what about children who don't have study materials? TVs, radios, how should we learn? I hear that the government is planning to open schools for candidate classes. What about us? What will happen? Next.
All right. Mary, thank you for your question. Mary's question, I think, goes to Commissioner Melinda. And the question, Mary is from Karamoja, and she says, what about the children who do not have study materials, they don't have TVs or electricity, and they're hearing that you might open for other schools? What happens to them? How should they learn? Commissioner?
I don't know, can I respond at this time?
Yes, we can hear you.
Hello?
Yes.
Okay, thank you, colleagues who are in the studio, and thank you, the organizers of this forum. I think it has been timely. In the interest of time, I've already said, let me go straight to the question. If you allowing the candidate classes and finalists, how about the rest of the classes? So it is in our plan. What we are doing, we are saying we are reopening schools in a phased manner. We're starting with the candidate classes because they don't have that much time to even cope up. So what we are saying, let's now first deal with the candidate classes, see how the situation will unfold, and then at a later stage, we shall be going in the rest of the classes. It should be the last thing to think about that we are losing a year. So we are trying our level best as a ministry to make sure that we provide whatever we were supposed to provide so that the candidate classes can come back, and then we'll be proceeding, of course, after some time, after we have learned to know how the situation now unfolds, we shall be we need to be reassured that at one point in time schools are going to reopen and we shall have all the students catered for. But in the meantime, as we plan for the candidate classes and finals to come back, we are not forgetting even the rest of the classes, because we know the candidate classes are just making a small percentage. The biggest percentage is by the rest of classes. So we are also planning for those who are at home. Much as we are looking at the candidate classes, we are looking at also those who are at home. And that's why now we came up with a back for interventions. We came up with a TV, with a radio, with online, and self-study materials. That's why I need to make the point clear. The self-study materials, we are targeting those learners who could not access the radio, who could not access the TV and online. How are we targeting them? That's why when we produce these materials, we form some kind of a channel or a mechanism of how they are reaching you at your homes. And then one point which you will need to appreciate that in the first development of the materials, we did come up with 25%, which wouldn't really suffice for all the numbers we have at home. So this time round, we are coming up with another round self-study materials, and in here we are planning to have it 100% that every learner now receive these materials. And remember, the previous materials we supplied were for the work that had been covered by the schools closed. So the new materials will now be looking at the new areas which had not been covered. So rest assured, we are bringing materials and to you in your homes, right? Those who cannot access TV and radio. But that said, you must have had the president, of course, committing to provide radio sets and the TV sets. So preparations are underway to make sure that these radio sets are provided so that our learners can be able to make use of them and be able to attend to the radio lessons. And I want to appeal to our people out there that when these radios finally come, these are radios for learning. So our parents, please, you give space, you give time to our learners to access the radios and then be able to learn. So materials are coming, radio programs are on, and the TV programs and the online, those who can access online, the materials are already uploaded. So you have all the opportunities to have the materials coming to you.
Just reiterating the promise that has been made by the President, but also the First Lady, Minister of Education, about the learning materials reaching the students in the different districts. Let's take a question from Josephine Noe in Bidi. Josephine, can you hear me?
Yeah.
All right, please ask your question.
Okay, my name is Josephine. I'm a refugee girl from Bidi refugee settled. I'm a mobile journalist. I've been doing stories in my community about this disease, COVID-19. And my question goes to the ministers and the government. My question goes like this. As I can see, doctors, teachers, armies, and some of the NGOs are fighting against this disease, COVID-19. And how about children? How are they going to involve children to fight the disease too?
All right, thank you very much, Josephine. Josephine is from Bidi, and she's asking, they see you involving just about everyone in the fight against COVID-19. What of the children? How are you involving them? And I guess this question is for you, Dr. Jessica.
Thank you very much, my colleague from Bidi, and thank you for the good work for the journalism. Whereas the main target and the main limelight has been focused on looking at service providers, what we are providing for families, food, treatment, truck drivers. As I said earlier on, behind the scene, there are children. And as we got settled in, the lockdown gave us some time to prepare and set systems to receive the expected number of patients, which is likely to increase. Alongside that, we have also been looking at other segments of populations. And for the children in particular, our main concern has been to start by helping them to understand risk of disease. Children don't understand risk of disease the same way, and depending on the different age group, children understand risk differently. Sometimes people think children don't understand, but if you bring this closer to their age, you'll find that there are mechanisms of understanding, either through drawings. Children can draw and express their fears, their concerns, but also as the children become bigger, 7, 13, we also have a risk that sometimes they want to come in and support and take over parental roles. You've heard about a child who's going to sell alcohol to help the mother. When the family is so distressed, the children will read the signals, because children are used to normalness, sameness. They want to feel safe in their environment, but once they sense that there is danger, the father has beaten the mother has shouted at the father, or there is crying, or the TV is showing very scary things, the children respond. And most times they respond in a way which is detrimental to their development. So our program has focused mostly on looking at the child as an individual and having mechanisms to support them, mostly psychosocial support.
All right.
We've been accessing and providing support through other structures in the communities, but mostly also focusing on the families which have been affected, either because there's a patient or because there's a family which has been quarantined. So we are moving to these households through the district task forces and the community development officers and other health workers to see how we support these families, starting from basic things like food, having food security, providing some of the basic needs, and slowly discussing and helping to open up these children and prepare them for the consequences or the challenges they are going to face.
Right.
That has been our main approach.
All right, thank you very much, Dr. Jessica. Because of time, unfortunately, I'm not going to allow the other children to ask their questions, but they'd already sent them in. So what I will do is I will read out the questions, and in your closing remarks, each of you in a minute, you can, respond to the question. There's a question from Justice Barak. Thank you very much for all the children who have participated. There's a question from Justice Barak in Busia District who says, children are having to work and haul goods, even to truck drivers, and the police isn't doing anything about it. What will they do? That's from Justice Barak in Busia. Another question is from Nema Kembabazi who says, there is a rise in abuse of girls. What are you going to do to the men who impregnate girls in this period? Nema is from Wakiso. Najib Sechito in Wakiso says, when will candidates be able to do their exams? That question for you, Mr. Mlindwa, will come to you. Josephine Chisache in Wakiso says, some health workers ask for money when children go to hospital. What will the Ministry of Health do to stop that? And the final question, Lucia Pio in Napak says, how are we supposed to follow the Ministry of Health guidelines if we cannot afford soap and face masks? So I will start with Mr. Mlindwa in just a minute. If you can respond to your questions on education. Let's keep it very brief because we've run out of time. Mr. Mlindwa? In your concluding remarks. All right, Mr. Mlindwa, you've lost the sound. You probably muted your microphone. You might want to unmute that before you start to speak.
Sorry, I muted, sorry. But what I'm saying, when exams be done, of course, when we open schools, immediately UNEB will now come up with an arrangement of when and how the exams are going to be done. But as I even talk now, UNEB is doing some preparatory work on these exams. But again, the issue is one. We shouldn't be rushing for exams before we cover what we are supposed to cover. So as a ministry, we are planning for both, to make sure the students cover what they are supposed to cover, but at the same time be able to do the exams. Two, there was a question which was asked, what if the situation worsens? Shall we never go back to school? I want to reassure you, we shall have to go back to school. And why? Because this is a new normal now. We must learn how to live with the COVID, because it's not going away within 2 or 3 weeks or a month. So we must learn how to stay with the COVID. And I want to assure you, we shall have to reopen at one point in time. What we need to do is to prepare to make sure that when we go back to school and we still have COVID, our learners are safe and secure and not affected. So basically, those are the two, I think, things which I had to respond to. But otherwise, I thank you for this forum, and how I wish that we could have another session and have this interaction running. So we are consulting, even here, we are consulting, we are picking your thoughts, and they will help to inform our guidelines. Thank you.
Mr. Fredenanga, very, very quickly, our time is spent. If you could take your questions and wrap up.
Yeah, thank you very much. I think the question you are talking about is about our children who are selling food items to
truck drivers.
And that comes out of issues surrounding child labor and so on and so forth. But Issues of child labor is an area that we've been fighting and trying to address with the Ministry of Gender by engaging widely parents and guardians who really get to send out children to go and vend food items.
Okay.
It's a very risky behavior. I remember, if you could have followed, there was around Kira Road where there was a shack, an incompleted house, and this girl was vending maize, roasted boiled maize, and then she was called to that incomplete structure, and at 11 years old she was sexually assaulted and eventually strangled. So wherever we do send out these children, we are sending them to an environment that is quite hostile for them. So it's always important that we, the elders, get to take the lead and leave these children to stay at home in very controlled environments and so on.
All right.
So,
very quickly, Mr. Nanga.
We are saying that right now there are a lot of disruptions in the environment that children are having in their homes. The COVID has affected them very, very much. And the cases that we are having right now that are on the rise, despite the fact that traditionally crimes are low, is those other issues of child abuse.
Mr. Nanga, they're going to cut me short, so I will allow a doctor to just speak very briefly, and then Mr. Commissioner will speak.
Yeah, maybe just to reassure the children, the masks have come. Finally, we have sent the masks to the districts, and we are going to begin with the districts around the borders, because that's where we have the highest risk. So we have already commissioned the masks, and we are sending them to the districts. The local council leaders will distribute these masks to you. So look out for the masks, and we shall monitor the distribution. About other requirements, the issue of selling, paying in the health facility, that is against our policy. And like other things we have discussed, it's very important to bring this to people's attention, and it can be followed up. It's a crime to pay money, because our services are very free, both preventive and treatment, and we'll be looking out for that. So thank you very much, our children, and we wish you well in this COVID. Be resilient, be active, and learn more about COVID. And most important, take care of yourself and keep safe.
Commissioner Chataka?
Thank you, Josephine. Josephine, the worst crime that anybody can commit is to make a child pregnant, let alone sleeping with a child. I was reading the story in the Antonde, 25 girls in the first month of the lockdown got pregnant. These cases must be followed up, and we are doing this through our child helpline. We are working with the police to ensure that we follow up this. So the point I make is that don't conceal any kind of defilement. Don't conceal any kind of child abuse. Report. I've given you the numbers, 116, so that these criminal offenses are attended to. Once you conceal it, you become part of the problem. Right. Nelson Mandela said, there is no keener revelation of a society's soul than the way society looks after its children. Let's look after our children very well, especially during COVID-19.
I couldn't have said it better. Thank you so much for closing us with that quote from Nelson Mandela. And thank you to all our panelists and the children who joined in on the conversation. And that brings us to the end of our show, our health and protection in the face of COVID-19.